Hi, I'm Dr. Catherine Gay. I've been with the Pennsylvania SPCA since March 2017.
My name is Maddie Hood. I'm the Outreach and Humane Education Manager at the Pennsylvania SPCA.
Parvo is a highly contagious disease that causes severe vomiting and diarrhea in dogs. Initially, dogs can present as being lethargic, maybe they're not so hungry, but pretty rapidly they'll have explosive, often bloody diarrhea and vomiting. They can't keep anything down, and without treatments they can die very quickly. It's highly contagious. It's caused by a very small or parvovirus, which is non-enveloped, meaning that it can survive on surfaces for very long periods of time. We're set up to keep our regular patients, our shelter animals, and our non-parvo outpatients healthy. So disease control, infectious disease control is really paramount here. And we're structured to use a separate entrance, and we take strict measures so as not to track this hardy virus throughout the hospital. We also have signage that's very important to warn the public not to cross past a certain point. The gold standard inpatient hospitalization costs in the thousands of dollars. Outpatient protocols can cost in the hundreds of dollars, but thanks to the generosity of Maddie's fund, we're able to offer this program to clients at no cost to themselves.
Adding outreach to the parvovirus outpatient clinic made a lot of sense this year. We really wanted to think about how to provide support for the families while their puppies were experiencing parvo, but also to help them kind of think beyond parvo and how to kind of rebuild their health and to provide access to someone to problem solve issues and to kind of think about the long-term needs of their puppies and their throughout their lifetimes. The goal of the outreach program is to do a number of things. One was immediately to help provide and create handouts and resources and materials that helped pet owners understand parvo, how parvo is spread, how to care for a puppy with parvo, not just materials that were bilingual, but spoke to the literacy level and kind of provided a kind of bigger picture of how to understand parvo in the environment and for their puppies in their home. Another goal was to work with the veterinary students to be able to support them in working with low-income pet owners to have tough conversations around spay and neuter, anything that might arise, just supporting them in having the conversations and providing the best care possible for our patients in the parvo clinic. And then, working with the families specifically to build a long-term relationship so that they had a resource, and they have a resource here at the Pennsylvania SPCA, so that if any issue arises beyond that critical case of parvo, we are their person to reach out to talk to problem solve that problem, and also being able to connect to the immediate resources connected to the clinic. So the 2-week medical recheck, the booster shots, the access to spay and neuter, and talking through why it's so important to spay and neuter pets who have had parvo and have parvo in their environment in their home. One of the big pieces of adding the outreach program to our parvovirus outpatient treatment clinic this year was we added a counseling piece. So the day before every puppy tested negative for parvo, I sat down and had a conversation with family members about their puppy. The puppy would stay with our veterinary students in the clinic. We'd step outside and we'd have a sit-down conversation to talk about how they were doing, what their experience was like, and any needs that they had immediately, but also kind of long-term needs to kind of talk about their puppy and figure out where they wanted to head. These counseling sessions didn't just provide opportunities to talk about the follow-up services like the rechecks and the boosters and spay and neuter, but it also gave us, 10, 20, 30 minutes to step aside and figure out what pet owners, needed beyond those things, beyond those services. And if there's anything I can recommend, I would say being able to build in more services, more resources to be able to spend that time to have those conversations, and also to think through how we can build in support pieces to look beyond the immediate follow-up services to provide, access and to services and information about, flea and tick medication and, just basic husbandry needs.